I'm Becky. I'm 30 years old and I'm 3'9".
I'm Craig. I am 34 years old and I'm 4'5".
We come from completely different families. My family's very outspoken. Are you done over there? Get in the kitchen.
My family is a little more reserved.
Go before I run you over.
Won't be the first time.
Yes, all this crap burnt on the bottom.
Hey. Becky and I met on a dating website for little people.
We got married 2 years later. God, you're so annoying.
Like most couples, we definitely have our disagreements.
Why can't you just go to a bar and sit down and drink? Why do you gotta go club?
Massage my feet.
That'll be the day. But we are very much in love.
I always wanted to have a child.
I wasn't so sure I wanted to have children.
Then, a year after we got married, we found out Becky was pregnant. See how this goes on the baby's head?
You know how much of an idiot you look right now. Being a little person, I knew my pregnancy would be difficult because of the extra weight on my joints and the extra pressure on my lungs. Now Charlie's moving.
We know we're having a boy, but it's anyone's guess what size he'll be.
Our child has a 75% chance of having a type of dwarfism and a 25% chance of being average sized. Right now I'm at 36 weeks. Overall, the pregnancy is going well. Just a few aches and pains and trouble breathing when walking.
We are beginning our weekly appointments up until the birth. So Becky's at 36 weeks. So we'll be seeing a doctor now, every week now.
For checkup, for heartbeat, and that sort of thing.
Mm-hmm. So, yay, winding down.
When I met Dr. Felluca, I knew I'd be her first little person patient. It did not concern me. I knew the chances of finding a doctor that actually had a little person as a patient would be very slim, especially in our area. What's my weight? Oh my gosh, I really ballooned up. I was 127 for a while.
Becky is truly a high-risk pregnancy. In Becky's case with the pseudochondroplasia, her hips as well as her back are being pressed or pinched potentially by the extra weight and pressure from the pregnancy. Because her torso is a lot shorter than most normal statured individuals.
Wow, that's a big step.
She's carrying an extra load and extra weight, and on her back, as well as her hips and her joints, she can constantly be in pain or also have spinal nerve compression, could have numbness, tingling, inability to walk, incontinence. All these things are possibilities. One of the things I noticed today with Becky when she came in for her visit is that her blood pressure was elevated. I am a little worried about your pressure though, so I'm gonna can I look at your ankles here and pull this up a little bit? How's your knees? Do you have pain in your knees?
Every day. Once we found out that I had high blood pressure, the main concern was making sure that Charlie was okay.
All right, I'm gonna let you lay on your left side for about 5 minutes, and then I'll have them redo a blood pressure right here in the room.
Alrighty.
Okay?
Sounds good. If the blood pressure comes back still high, I'm gonna have to get blood work done. And then after that, I guess depending on what my blood work shows, I might actually have to deliver earlier than 39 weeks, so.
128 over 66.
Getting better?
That's good news.
Okay, so Dr. Felluca will be with you in a few minutes, okay? Okay.
Well, at least it's better, so.
Yeah, but now I have to get blood work.
Come in. Hello.
Don't cry. You know you're gonna have a baby. That part we know.
Yes, I know.
Yeah,
Okay.
a healthy heartbeat.
Baby just wants an earlier birthday, that's all. You just weren't ready, is that what it is? Okay. If your blood pressure is high and your blood work shows that you're having problems with your liver enzymes being elevated, high liver enzymes, when your liver's not functioning quite correctly, all these things can be indications that you need to be delivered now, okay? One of the things we have to look for is to see how Becky is doing and how her infant is doing well. In her instance, with her blood pressure being elevated, if her platelet count starts to decrease, we need to deliver her relatively rapidly so that both her and the baby do well.
Okay. They checked my blood pressure for the second time. It was still high. After that, Dr. Felluca wanted me to check into Reston Hospital. I was supposed to go to work tomorrow. I was supposed to work after this. Appointments.
Oh, you're officially off.
I hate being stuck with needles.
wasn't prepared.
We're just waiting to hear the results. I mean, there's a good chance that you could have the C-section tonight or tomorrow, so we're not ready yet. Hopefully it's good and we can go home and just put Becky to bed. I'm concerned about Becky's health and about the baby, but the excitement knowing that, there's a chance that, Charlie can be born within 24 hours, But the only thing I want right now is a healthy wife and a healthy child.
She's having contractions every 2 minutes. Sometimes the cervix will dilate with contractions. However, because of being a little person, her pelvis is also different than the average individual. If her pelvis, and because her bone structure is contracted, she won't necessarily dilate through her cervix, but she could dilate through the lower uterine segment, which is where the C-section would be performed. We have to be careful that she's not contracting and dilating or thinning out her lower uterine segment, which would cause the uterus to rupture.
Since waiting to the morning is below 100, I'm not going to be happy, and neither will you. And you're feeling the contractions. You weren't feeling them before, so what are we waiting for? This baby says I want out.
We found out that my platelet level was dropping, and also I'm having contractions that are getting more intense by the minute. So Dr. Felluca decided that we needed to have the C-section done tonight.
You have to stop shaking first. You're going to be a mom. I wasn't ready.
Being wheeled into the operating room for the C-section was pretty much a blur. I don't remember too much. I just remember being overwhelmed. I remember shaking.
Ready? Just get your head up. 1, 2, 3.
Once Becky was finished with the epidural, they allowed me in, and they placed me next to Becky's head. I couldn't see much because they had a big blue screen in front of our faces. I couldn't see anything, just could hear things.
Craig stood beside me and was holding my hand through the whole thing.
I was able to hold her hand, comfort her as best I can. All new parents have challenges. I guess little people, parents, have maybe more challenges than the average size couple. Becky and I both felt actually we were ready to be parents. Whatever challenges we face, we will find a way to overcome them. That's how we live, Becky and I. We face a challenge and we overcome it, and we're ready. The one thing I do remember that really sticks out was hearing Charlie born. The doctor saying, "Okay, we're gonna do a lot of tugging," and I was just ready. And next thing I heard her cry. Gosh, I'll never get that sound on my head. It's such a wonderful sound. And I finally seen him walking across the curtain and has this baby here. I was like, is this really my baby?
My first reaction when they told me that Charlie was into the world was how much did he weigh? Because being 36 weeks, I was really concerned about that.
7 pounds, 5.5 ounces.
Hi, Mommy.
Yes, isn't he beautiful?
February 26th.
When I first saw Charlie, the thought of if he's going to be average size or a little person never really crossed my mind. At that time, I was just looking at my son. I wasn't putting labels. The facts are, he's my son. He's part of my wife and I, and I'm going to love him as much as I can without the labels. And we'll find out later, soon enough, if he's going to be average size or a little person. But either way, doesn't matter to me. I couldn't believe it, that this is ours. This beautiful boy, this beautiful son, this is ours. I just couldn't believe it.